Hello dear patients, today we are going to review the case of edema and thickening of foreskin and tenderness of inguinal lymph nodes. A patient came to us with such symptoms. You can see a photo of his foreskin. He had edema of foreskin. It was more common closer to the evening time. In the morning such edema was almost absent. There was no tenderness, there was a feeling of foreign body in foreskin. Also, there was tenderness and some swelling of inguinal lymph nodes. This patient recently had an acute respiratory disease and he never had allergies before. So, during such symptoms, analyses are taken for sexually transmitted infections, including smear tests, blood for syphilis and hepatitis. However, all of such analyses were negative. As a result of that, we came to a conclusion that analyses for allergy have to be taken. You can watch separate video about what it is on our channel. We took immunoglobulin E analysis, circulating immune complexes, eosinophilic cationic protein and general blood analysis. As a result of that, increased number of eosinophiles was found. It was about 5 times more. Eosinophilic cationic protein was increased, and immunoglobulin E was increased approximately 8 times from normal. A conclusion that its toxicoallergic reaction was done. It was a consequence of acute respiratory disease, or to the following intake of different pharmaceuticals, including non-steroidal, anti-inflammatory ones, etc. The patient was referred to allergologist consultation with deeper analysis for allergy. We are not going to talk about it now. We prescribed sodium thiosulfate and calcium gluconate. There were intravenous drops of sodium thiosulfate on normal saline, calcium gluconate intramuscularly. After analysis, allergologist prescribed antihistamine and other medications. Corresponding recommendations were given about intolerance. As for symptoms, they disappeared approximately on 3rd-5th day after prescription of sodium thiosulfate and calcium gluconate. This indicates a toxicoallergic reaction after acute respiratory disease. Often, different edemas of sexual organs, reddenings, can be directly unrelated to sexually transmitted infections. However, such infections as herpes have to be excluded here, as it can be inside the urethra. Such diseases as syphilis, HIV have to be also excluded. This has to be done because such enlargement of inguinal lymph nodes, tenderness and edemas of foreskin can mask such infections. If it's necessary to diagnose and treat any rashes and changes in the area of sexual organs, you can consult urologists and venerologists of our paid medical center of Dermatoneurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such changes. We're waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.